Another important factor is habit. Changing of bad habit should be done with patience and gradually. You should consider the habit and job of the patient sometimes for medication, and knowing the habits sometimes help you to reach diagnosis of the cause. For example, bakers have long contact with heat. Sometimes they use cold water to cool themselves, and this long contact with heat and using cold material beverage for correcting can cause warm distemperament and cold distemperament. You should consider these habits for correcting the distemperament. It is done by management of 6 essential. You learned it. Another important factor is land. Land can affect climate, can affect habit, can affect intrinsic temperament, can affect the food and plant or animals which are consumed as food in the area, and also can affect the medicines, the herbal medicines. For example, in my country, Iran, we have red rose in 2 areas. Excuse me. Sometimes red rose, which is grown in cold, high altitude mountain area, act like a drug with constipation effect. And red rose, which grew in warm, low altitude without mountain area, can act as a purgative medicine. It is important to consider. Sometimes the meat of animals in warm area can cause diseases, and you should consider it, and you should have a proper medication for correcting this harmful effect. And climate is also important. Usually in warm climate, digestion is weak, and in cold climate area, digestion is strong. So if you have any maldigestion in a cold climate area, you should think that the causes of the disease are strong, and you should consider using potent drug or potent medications. Reversely, in warm climate area, maldigestion is common and could be treated easily by managing of 6 essentials or using mild potent drug. Another factor is time of the day. For prescribing of some drugs or some manual therapy, the most balanced time of the day is important. For example, using vomiting agent in summer is better in early morning. On the other hand, in winter, using some purgatives is better in noon. has a most balanced time of winter days. Another another important factor that should be considered is a stage of disease. In disease we have 4 stages usually: initial stage, increasing stage, plateau stage, and decreasing stage. If, for example, your inflammation is in a stable or plateau stage, you can drainage the abscess or drainage the material part of the disease directly from the organ. But if your inflammation, for example, is in its increasing phase, you should divert it toward a non-noble near organ. So the determination of a stage of disease is an important factor in some disease like inflammation or fever, for example. Another important factor is direction of treatment. You should determine the location of disease or inflammation sometimes. For example, in inflammation in the liver, if the inflammation is in superior part of the liver, the best way for expelling or evacuating the waste will be using diuretics. But if you have inflammation in inferior part of the liver, using purgatives and agents that cause diarrhea will be a better decision. Another important factor is specificity of organ. In some specific organs, for example, in noble and chief organs, using potent drug or expelling drug should be by caution, because usually potent and expelling drug cause weakness, and weakness of a chief organ or a noble organ will lead to damage of all of the body as a consequence, especially in chief organs or in those noble organs that serves all of the body, like stomach. In some organs with compact consistency, like kidney, we can easily use potent drug. But in another organs like lungs, which are spongy and loose, we barely can use potent drug. Some organs like liver have medium consistency, and we can use medium potent drug for treatment of the liver, for example. And another factor is distance of organ from your medication. For example, esophagus is in direct contact with oral medication. We can easily affect on temperament of esophagus, but lungs should wait to digested drug from the liver, pass the heart, and then reach to them. So we have a small intake by lung from oral drugs. We should consider using vaporized drug to treatment the lung. Lung for treatment is a difficult part of the body.